Hi, Dr. Doug Graham here, author of the 80-10-10 diet, and today I want to talk to you about sleep. How much sleep do we need? Are you getting enough sleep? And perhaps even a little bit about the quality of your sleep. So, for starters, how much sleep do you need? And the answer is easy. You need to get enough sleep. Anything less than enough sleep is not enough sleep. And that might seem pretty straightforward and possibly vague, but it's not. Your need for sleep varies. You're not a machine. There are days that are more demanding and days that are less demanding in a wide variety of ways, and no matter what's going on, it affects your need for sleep. Each night or each sleep cycle can vary. It doesn't have to be exactly 7 hours and 52 minutes and 35 seconds. There's no way to say exactly how much sleep a person needs, but it's an interesting piece of information, I think, to understand that the amount of sleep that most people get has varied quite a bit over the history of time. While we look at what people got 50 years ago, the average American was sleeping 8 hours per night, whereas today the average American is only sleeping 7 hours per night. 100 years ago, the average American was sleeping 9 hours per night. And if we go back in time a few hundred years ago, we'll see that most people were spending 10 to 11 hours per night in bed. Now, I think this is telling, and the thing that we're seeing is twofold. One, an increased reliance upon the use of stimulants rather than getting sleep, and two, the tensions associated with lack of sleep. People becoming a bit more aggressive, people becoming more short with each other, people driving in a hurry, people's health declining as a result of lack of sleep, including their mental, emotional, and physical health. So, how much sleep do you need? You need to get enough. And your body tells you. Your body tells you when you're thirsty. Your body tells you when you're hungry. Your body tells you when it's time to yawn. Your body tells you when you need to urinate. And your body tells you when you wake up in the morning whether you've had enough sleep or whether you'd rather choose to roll over than roll out of bed. It's a fairly simple thing. Now, often enough, if you want to keep track, see whether most of the time you roll out, even though you'd rather roll over, or how much of the time you roll over when you really have that feeling that you haven't yet had enough sleep. What's the trick to getting enough sleep? Getting to bed. The trick is getting to bed. But if you don't get to bed early enough, the morning's going to come anyway. So get to bed is the trick. And at first it might seem odd, might seem peculiar to go to bed a little earlier than you're used to. But don't worry, you'll get used to it. Getting to bed early, getting up early when you've had enough sleep, however much it takes, it's different for different people. It's different for different lifestyles. People on 80-10-10 typically find that they need about 2 hours less sleep than they needed when they were eating a standard Western diet. That's a huge increase in productivity opportunity. So if you eat really late, you might affect the quality of your sleep, especially if you eat heavy foods. The surefire recipe for nightmares is to eat nuts right before you go to bed, especially a lot of them. But the quality of your sleep can be affected in words that we use a lot. We have restless sleep and we have sleepless rest. A good night's sleep, you slept deeply and soundly. Or were you restless, tossing and turning all night long? You can affect the quality of your sleep. Keep a window open, get some fresh air. Make yourself as comfortable as possible. Be clean before you go to bed. And don't eat too much. Don't eat heavy food that's going to create a heavy digestive demand while you're sleeping, because you're either going to be sleeping or you're going to be digesting. If you're doing both, you're going to compromise the quality of your digestion. This is Dr. Doug Graham, looking forward to bringing you many more health tips.